Hi everyone, my name is Erin Foster, and thank you for joining me today. I'm going to talk about a topic that is devastating but crucial to understand, human trafficking, and more specifically, the critical role social workers play in preventing, identifying, and supporting survivors of trafficking. Social workers are often the first lifeline for victims, and with the right knowledge and tools, they can change the course of somebody's life. Human trafficking is the use of force, fraud, or coercion to exploit people for labor or commercial sex. It's important to realize that trafficking doesn't always involve movement or travel. People can be trafficked in their own neighborhoods, towns, or even homes. According to the International Labor Organization, over 25 million people are trafficked worldwide each year. In the United States, it's estimated that hundreds of thousands of adults and children are at risk annually. These are not just international crimes. They happen in our cities, suburbs, and rural communities. Anyone can be a victim, but certain populations are far more vulnerable, and that's where social workers step in. There are several major forms of human trafficking that social workers need to recognize. First is sex trafficking, which is often the most publicized. Victims are forced into prostitution, pornography, or sexual exploitation. Next is labor trafficking. Victims are forced to work in industries like agriculture, construction, domestic service, or factories under abusive conditions. Domestic servitude is a specific form of labor trafficking where victims work in a private household with no freedom to leave. And tragically, child trafficking cuts across all categories. Children may be exploited for labor, sex, or even illegal adoptions. Understanding these types helps social workers spot patterns and advocate for the right kind of support. Social workers are often the first, and sometimes only, professionals that trafficking victims trust. Whether it's in a school, hospital, mental health center, or shelter, social workers are positioned to see the signs that others may miss. Victims rarely self-identify. They may not even realize they are being trafficked because of manipulation, threats, or shame. Social workers know how to build relationships based on trust and compassion, which is crucial for disclosure. In many jurisdictions, social workers are mandated reporters, legally required to report suspected trafficking involving minors. Our role is not just to report, but to intervene with care, advocate for services, and create pathways to public safety and recovery. You may be asking yourself, who is at risk for trafficking? Unfortunately, it's often society's most vulnerable. Poverty is a huge driver. People desperate for work or survival are easier to exploit. Homelessness is another. Youth on the streets are frequently targeted within days of leaving homes. Children in foster care are at a particularly high risk, especially those who have experienced instability or abuse. Substance abuse, whether by the victim or their family members, can also increase vulnerability. And finally, lack of strong support systems. No trusted adults, families, or mentors leaves individuals exposed. Social workers with their deep understanding of social systems are key to recognizing when these risk factors pile up and create danger. Spotting a trafficking victim isn't always obvious, but there are physical, behavioral, and situational red flags. Physically, victims may have unexplained injuries, signs of malnutrition, untreated illnesses, or extreme exhaustion. Behaviorally, you might notice fearfulness, hypervigilance, submissiveness, or reluctance to make eye contact. Some survivors may appear unusually attached to an old boyfriend or employer. Situationally, they might not be in control of their own documents, may be unable to explain their whereabouts or show signs that someone else is speaking for them or controlling them. No single sign confirms trafficking, but together, these indicators should raise concern, and social workers are trained to trust their instincts when they see them. When trafficking is suspected, the priority is always the victim's immediate safety. The social worker should not confront the suspected trafficker directly. That can put the victim in even more danger. Instead, follow mandatory reporting laws if a minor is involved, and immediately engage proper authorities such as law enforcement or child protective services. It is crucial to use a trauma-informed approach in these conversations, asking open-ended, non-judgmental questions and assuring the individual that help is available. You might say, "You don't have to tell me everything today, but you're safe here, and we want to help you." Even small moments of trust can be the start of a survivor's journey to freedom. Rescuing someone from trafficking is just the beginning. Recovery is a long, complex process. Survivors often need immediate housing, safe places where they can heal without fear of re-trafficking. Mental health care is crucial, especially therapy focused on trauma and PTSD. Many survivors need education support to finish school or learn job skills, and employment assistance to build independent lives. For immigrant survivors, legal services are often a necessity to apply for visas or fight deportation. Social workers coordinate these services, advocate for survivor rights, and help restore hope and dignity. Without comprehensive, long-term support, survivors face high risks of falling back into cycles of exploitation. Everything we do as social workers must be trauma-informed when working with survivors of human trafficking. That means creating spaces of physical and emotional safety, building trust by being consistent, transparent, and honest, empowering survivors by giving them choices and respecting their autonomy. Collaboration, meaning working with survivors, not doing things to them, and cultural competence, understanding and respecting the survivor's background, whether that includes language, religion, or traditions. Trauma-informed care isn't just a strategy, it's a commitment to treating survivors with the dignity that they deserve. Social workers are part of a larger ecosystem of support. We collaborate with law enforcement to help ensure cases are handled appropriately with victim safety first. We work with healthcare providers to address medical and mental health needs. We team up with nonprofit organizations that offer housing, legal aid, or job training. And we often engage educators to help trafficked youth reintegrate into school settings. Collaboration is what makes the difference between a fragmented system and a true safety net for survivors of human trafficking. It is essential that social workers know their local resources and build strong professional networks. Prevention is powerful. Social workers can lead community education efforts, teaching parents, students, and community leaders about the signs of trafficking. We can develop outreach programs in shelters, juvenile centers, and high-risk neighborhoods. We can advocate at the policy level, pushing for laws that protect victims instead of punishing them, funding programs that provide real alternatives, and strengthening social safety nets that reduce vulnerability. Every prevention effort, no matter how small, is a step towards a world where fewer people are victimized in the first place. In closing, social workers are vital in the fight against human trafficking. We are the eyes and ears in communities. We are the safest person that victims can finally trust. We are the voice that pushes for better laws, stronger services, and real change. I encourage every social worker to seek out specialized training on trafficking, stay connected to the local resources, and advocate fiercely for our survivors' rights. because every survivor we help, every system that we improve, brings us closer to ending trafficking for good. Thank you for listening, and thank you for the work that you do.